Hey everyone! Welcome back to the channel. Today, we're tackling a critical global health issue: cardiovascular diseases. As the leading cause of death worldwide, these conditions impact millions, yet many are preventable. In this video, we'll explore different types of cardiovascular diseases, with a special focus on coronary artery disease, CAD. We'll break down how the heart functions, what goes wrong in heart diseases, and how we can prevent these life-threatening conditions. Let's get started. Coronary artery disease, CAD, occurs when plaque accumulates in the coronary arteries, reducing blood flow to the heart. These arteries supply oxygen-rich blood to the heart muscle, and their narrowing due to atherosclerosis can lead to angina, chest pain signaling reduced oxygen supply. Angina is of two types. Stable angina occurs during exertion and improves with rest. Unstable angina can happen anytime and signals a higher risk of a heart attack. A heart attack happens when a coronary artery is fully blocked, cutting off blood supply and leading to irreversible heart muscle damage. A heart attack results from a sudden coronary artery blockage, depriving a part of the heart muscle of oxygen. If untreated, it can lead to heart failure, where the heart struggles to pump blood efficiently. Symptoms include fatigue, breathlessness, and swelling in the legs and abdomen. Heart failure can be right-sided, causing fluid buildup in the body. Left-sided, leading to fluid in the lungs and breathing difficulties. Congestive heart failure, which affects both sides and is the most severe form. Cardiomyopathies are diseases that affect the heart muscle, making it thick, stiff, or weak. The three main types are: dilated cardiomyopathy, enlarged ventricles weaken blood output. Hypertrophic cardiomyopathy, thickened heart muscle impairs blood filling. Restrictive cardiomyopathy, stiffened ventricular walls restrict blood flow. These conditions can cause arrhythmias and, in severe cases, sudden cardiac arrest. The aorta, the body's largest artery, can develop serious conditions: aortic aneurysm, abnormal widening that may rupture, causing internal bleeding. Aortic dissection, blood enters the aortic wall layers, leading to severe pain and a risk of rupture. Peripheral vascular disease, PVD, occurs when plaque builds up in arteries supplying the limbs, mainly the legs. It causes pain while walking, intermittent claudication, and, in severe cases, can lead to gangrene and limb amputation. Heart valves regulate blood flow, but when they become narrowed, stenosis, or leaky regurgitation, it leads to valvular heart disease. A major cause is rheumatic heart disease, which results from untreated strep throat infections. Pericarditis is inflammation of the heart's protective sac, pericardium, causing sharp chest pain that worsens with movement or breathing. If fluid accumulates around the heart, it can lead to cardiac tamponade, a life-threatening emergency. Some heart diseases are present from birth and require early intervention. Common congenital heart defects include patent foramen ovale, PFO, an opening between the heart's upper chambers that remains after birth. Patent ductus arteriosus, PDA, a persistent connection between the aorta and pulmonary artery. Coarctation of the aorta, aortic narrowing that leads to high blood pressure. Tetralogy of Fallot, a combination of 4 defects that cause oxygen-poor blood circulation. These conditions often require surgery early in life. Atherosclerosis, the buildup of fatty deposits in arteries, is the root cause of many cardiovascular diseases. It narrows arteries, increasing the risk of heart attacks and strokes. Risk factors include non-modifiable factors, age, family history, and male gender. Modifiable factors: smoking, poor diet, inactivity, obesity, diabetes, high blood pressure, and chronic stress. Lifestyle changes can significantly reduce cardiovascular disease risk. Preventing cardiovascular diseases involves 2 key strategies: primary prevention, stopping heart disease before it starts by maintaining a healthy lifestyle, eating well, exercising, quitting smoking, and managing conditions like diabetes and hypertension. Secondary prevention, reducing complications in those already diagnosed. This includes medications like statins to lower cholesterol, aspirin to prevent blood clots, lifestyle changes to slow disease progression. Doctors use the Q-Risk score to assess a person's 10-year heart disease risk. If high, interventions like medications, angioplasty, stents, or bypass surgery may be necessary. If you found this video helpful, don't forget to like, subscribe, and share. Drop your questions in the comments, and I'll be happy to answer them. Stay healthy, stay informed, and see you in the next video.